So welcome everyone. Good morning. My name is Lori Marie Peixoto. I'm Executive Director of the Mental Health Association of Rhode Island. Our mission is to promote and nourish mental health through policy development, advocacy, and education. Today we are gathered with our leaders to talk about the most pressing issues facing Rhode Islanders and how the $1.1 billion of American Rescue Plan Act funding might be used to address some of these crises. So we're here today to provide some input to our leaders and also to sort of pick their brains about what they might do with this ARPA funding. And of course, the ARPA funding is just a starting point. This town hall is supported by the Mental Health Association of Rhode Island, Homes Rhode Island, NAMI Rhode Island, Oasis Wellness and Recovery Center of Rhode Island, Protect Our Healthcare Coalition, the Rhode Island Psychiatric Society, the Center for Southeast Asians, Rhode Island Mental Health Counselors Association, and the Wilson Organization for Diversity, Equity, and Inclusion. This event is being recorded and will be placed on the Mental Health Association's YouTube page today. Today's agenda is as follows. So first, I will introduce Governor McKee and hopefully Representative Tobon if he can join us. Each of them will make opening remarks. Then we will hear from 4 community advocates about the most pressing issues of our time right now in Rhode Island. Then we'll ask some prepared questions of Governor McKee and Representative Tobon. And then I would love to open up a dialogue between our leaders and our audience members. So if you have a question and you're in the audience today, please type it into the Q&A box rather than the chat box. And if I select your question, I will unmute your microphone and you can ask your question directly to Governor McKee and or Representative Tobon. Before we kick off the event, I believe it's important to establish some rules of engagement to make sure that we have a productive conversation with our leaders. So there are 3 rules for today. Number 1, let's assume positive intent from one another. Sometimes we misspeak, sometimes we don't say things in the most politically correct way. Let's assume good intentions from each other. Each of us has an inner child that needs to feel compassion and a sense of safety. So let's be gentle with one another today. We can speak truth, but in a way that is kind and respectful. Number 2, life is a classroom. So this event is an opportunity to learn from one another. We must value life experience as much as we value expertise. Both are important. And number 3, if you have a question, as I said, type it into the Q&A box. I'll try to get to as many questions as possible. I know Governor McKee has to hop off at 10:45, so I hope we can run through this quickly so that folks have enough time to ask questions. I'll call on you and unmute you, and if you could introduce yourself and then ask your question as concisely as possible. Brevity is a virtue. So now it is my great honor and privilege to introduce Governor Daniel McKee. We are so thrilled and grateful to have you with us. We do not take your time for granted. And Governor McKee, we welcome you. And I would love for you to say a few words, if you would.
Well, Lori, thank you. And thanks for the invite. I think that it is a very an opportunity that Rhode Island has right now, both in the recovery dollars that you're talking about, that 1.1 billion, and also in projecting what Rhode Island's going to look like in 2030. So I want to just bring to your attention the work that Lieutenant Governor and I have been involved with over the last several months in terms of shaping a draft of a Rhode Island 2030 footprint that addresses many of the things that I'm going to be hearing today from you, but also economic issues and as well as education issues. So, but I would focus on the Rhode Island rebounds and just kind of clarify what we're doing there. We're in a spot right now in Rhode Island where we've been very fortunate to move from a very low vaccinated state in March to the 2nd highest vaccinated state in the country, and with over 90% of our adult population with at least one shot in the arm, which is phenomenal, and it's a lot of work, and a number of people that worked on that. I'm sure the many people on the call have been involved in that effort. And then also lowering our infection rate, our hospitalization rates, our death rates, which were highest in the country in March, and they're virtually the lowest in the country right now. And it has also allowed us some ability to transition into reopening our economy right now. Moody's has ranked us as #1 in the Northeast in terms of recovery, #3 in the country. And that's really important for us, because in order for us to provide services and other needs, we need to have a strong economy. So those are the things that kind of position us pretty strongly right now, is the fact that we have the vaccination issue, so that we are really managing Delta. There's always some concerns about that, but we are managing Delta as well as anybody in the country right now, and then the economy is strong. And then we get into this idea of like mapping out a 2030 strategy. So I would just say that, we need to invest wisely, and we need to make sure that we get value out of it. $1 billion sounds like a lot of money, but when you carve it up in terms of all the people who are, making good recommendations, it shrinks considerably, right, in terms of how you're going to distribute the dollars in a way that makes the most sense. The 2030 plan is projecting out, 10 years out in many categories: environmentally, health, economic, education, and we know that the $1.1 billion is not going to satisfy all those needs over that period of time, right? So we're going to work with the General Assembly to try to. My recommendation was a 10% out, so that you could keep the economy going in a way, address some housing issues that are imminent right now, and as mentioned in some of the review coming to this meeting in terms of immediate need on homeless issues, and then look at some of the childcare issues, right? Because the childcare issues are directly related into getting people back to work and having the children being cared for in a way that people feel comfortable getting back to work. So I look at this as another opportunity, Lori, to really hear and listen, and where I can make comments, I will. But yeah, I thank you for the opportunity to come in and sit and listen to some of the specific it's agenda issues that you've outlined before I got on the call. So I'll just open it up from that, and you can have the microphone back.
Thank you so much, Governor McKee. We really appreciated hearing your ideas about how to spend this money and the 2030 plan. And I'm so glad that we're thinking about long-term plans and projecting a decade out. I think that's really important. And I think it's also important that we look at the ARPA funding as just a starting point. It's just a place where we can begin to infuse some of the much needed dollars into these crises going on in Rhode Island right now. And so I know that this conversation will go on beyond the ARPA funding, because we'll be talking about how Rhode Island can invest its own dollars into these very important issues as well. Our next guest would have been Representative Carlos Tobon from Pawtucket's District 53. Unfortunately, due to unforeseen circumstances, Representative Tobon had to be on a plane this morning, and he's trying his hardest to access this Zoom call on American Airlines internet, and I think it's not going so well. So perhaps he'll be able to join us at some point later. Hopefully he won't give up on us, but just know that he really wanted to be here with us, and he tried his best to join us even from a plane. That's how much he cares about this event. But let's proceed anyway. Let's get down to business. Our first crisis that we should talk about tackling is climate change. Today, we are joined by Priscilla De La Cruz, who is Senior Director of Government Affairs at the Audubon Society of Rhode Island. Welcome, Priscilla. Thank you so much for being here.
Thank you so much for having me today. Thank you so much for the time. So Audubon Society of Rhode Island is an independent nonprofit that carefully follows the many threats to birds. And it's clear that climate change is the biggest threat. The latest climate science is telling us that the climate crisis is intensifying and accelerating and further threatening wildlife, our environment, and hand-on-hand increasing the vulnerability of the ocean state, of our economy, of our livelihoods, and our communities, especially frontline and environmental justice communities who are overburdened by pollution. This year, our state took a critical step when Governor McKee signed the 2021 Act on Climate, a landmark piece of legislation, and signed that into law, requiring a path to net zero carbon emissions by 2050. This provides the necessary and mandatory framework to help address the climate crisis. But there's still a lot more work to do to successfully implement the Act on Climate, including the need for adequate funding. And there is a cost to inaction, and that cost to inaction is real in the face of the climate crisis. But Rhode Island has the opportunity to really tap into the economic and the health benefits of investing in climate and taking climate action. And the time is really now to invest in climate and implement strong and swift climate action, and that's across the board and across all levels of government and in public and private spaces to really limit the impacts of climate change and adapt to the changes that are already baked into our environment, like sea level rise, severe storms that we're experiencing, extreme heating and warming oceans, and the list goes on in terms of the impacts that we're experiencing already due to the climate crisis. And the state can use this once in a generation federal spending opportunity to really invest in center climate and equity and in all spending on critical intersecting issues like affordable housing, economic development. These issues are all interconnected. So really, how do we comprehensively address the many crises that we're facing while centering climate and equity in our policy making? So let's center our climate goals and equity throughout all policy and investment solutions to really ensure that our communities remain resilient and also healthy in this changing climate. Thank you.
Thank you so much, Priscilla. That was wonderful. Now to our next crisis. Imagine you lose your job, or your business slows down, or your landlord increases your rent. You can no longer afford to pay rent or your mortgage on your house. That's the position that thousands of Rhode Islanders are in right now. We're seeing tent encampments pop up across the state. Shelters are full. People are sleeping in their cars or double-deck in relatives' homes. Imagine living under these conditions and how quickly your physical and mental health would deteriorate. Housing is healthcare, housing is recovery, housing is education and employment. It's the foundation of all the good things in our lives. I'm so pleased to present Daria Montequila to speak on this issue. Daria is Communications and Engagement Specialist of Housing Network of Rhode Island. Welcome, Daria.
Thank you so much, and thank you for the introduction. Thank you to the Mental Health Association of Rhode Island for hosting this town hall, and to all the panelists and guests who made it here today. Housing Network of Rhode Island is part of Homes Rhode Island, which is a coalition of organizations working together to increase and preserve the supply of safe, healthy, and affordable homes throughout Rhode Island. Housing is in a state of emergency in Rhode Island. There is a shortage of almost 22,000 rental units affordable and available to people with extremely low incomes. Emergency shelters are beyond capacity and hundreds of people are living outdoors as winter approaches. Evictions continue to displace families. Inadequate access to rentals coupled with the lack of tenant protections leave our low-income communities and Black, Indigenous, and people of color vulnerable to homelessness and disparate negative health impacts because they are more likely to be renters. Housing insecurity for BIPOC is further exacerbated when they or a family member are disabled because of restricted resources. Eviction diversion programs are critical to ensuring the safety of many vulnerable Rhode Islanders who have faced historical discriminatory housing practices. Last spring, the General Assembly and Governor McKee enacted a dedicated funding stream for affordable housing and source of income protections for tenants, which Homes Rhode Island advocates for. Impactful as these legislative ones are, we are facing a severe housing shortage. We do not have enough homes to house Rhode Islanders. Luckily, as we face this emergency, the American Rescue Plan Act provides an extraordinary opportunity for federal investment to respond to the coronavirus public health emergency and help redress its devastating economic effects in Rhode Island. We are pleased to see Governor McKee's proposal to invest $29 million of American Rescue Plan funds in housing affordability and security. This is a small but important step. To adequately respond to the scale of the current emergency, we recommend an investment of $500 million to produce, preserve, protect 2,500 affordable homes by 2030, promote housing access and stability, and to support communities to address issues associated with aging housing stock. We also support an immediate authorization of an additional $25 million to address emergency needs for hundreds of people who are sleeping in outdoor encampments and cars before winter begins in December. Investing in strategies to equitably increase access to safe, healthy, affordable homes is a powerful tool to begin to redress the harm toward our BIPOC and low-income communities and support our state's collective health and well-being. We cannot miss this chance, and the time to act is now. Thank you very much.
Thanks so much, Daria. Next, I'd like to welcome remarks from Tina Spears. Tina is the Executive Director of Community Provider Network of Rhode Island, and she will speak to the widespread staffing shortages in health and human services across Rhode Island. Thanks so much for joining us, Tina.
Thank you, Lori. Thank you for the introduction, and thank you for hosting this. This is such an important conversation. I know it's certainly uncomfortable. This is not where any of us want to be right now, but I appreciate the time, and certainly Governor McKee specifically for taking the time today and listening to our concerns and helping us find some solutions. So I'm here to really speak about the workforce, as Lori said. I'm just going to be frank. I have no other way to operate, so I'm just going to be honest. I would describe what we're experiencing in the health and human service space as a crisis. I'm going to be a little bit more dramatic. You can't see it the same way you can see a flood or a hurricane. But we literally have a public health disaster we are dealing with today. For many who work in this industry, this is an experience is like nothing we've ever seen before. It's been hard, it's been arduous before, but this is dramatic. The disaster unfolded due to the pandemic, but we had plenty of warning over the last decade of the mounting problem. Every year, advocates and providers have requested investments, informed of the struggles of our businesses and our workforce, but we've failed to achieve the action that was needed to shore up the behavioral health system and broadly the whole health and human service delivery system. We left this service delivery system vulnerable to the disaster of the results of a pandemic. And as a result, people are suffering, literally suffering each and every day. I'm just going to describe a couple of scenarios just so we can put life to the story. Early intervention service providers, and Governor, you know about this, and I know you've strongly advocated for a solution to this. We're close to referrals. Many programs are close to referrals, and those that are open are not doing well. I just got off a call with many of my providers, and some are considering closing. Children with developmental disabilities cannot access service. They cannot get the support that they need. Adults with disabilities cannot get the services they need. Individuals with behavioral health conditions are going untreated. That's the reality. And our workforce that is working to support those that we can support are working hard. They're stressed, they're tired, our retention rates are low, our turnover is very high. From a business perspective, that's disastrous. Because we've had trouble conveying this challenge, the reality of what's really happening, I'm going to try and just describe it so we can really understand what the impact of having a health and human service community-based system fail to do what it's intended to do, which is public service to the community. I would describe it as a levee. Right now, we were the levee that kept our schools healthy, that kept hospitalizations, acute behavioral health conditions or other conditions from mounting into that space. We help our fire, we help our police mitigate the impacts of untreated care. The levee's broken now. So we now have a situation where all of those other infrastructures are stressed. So we have some serious work to do in this space. some of the most important things that we can do today is immediately address the workers that we do have to retain them, value them, compensate them well. And then the second thing we need to do is really take a hard look at what we've done to finance the health and human service system over the last several decades and rebuild it. We need to rebuild it better than what we had before. So that's a stark reality of where we are today. But the good news is you have a strong community. We have people that are committed to this work and to our communities to make sure it's built back better. So we're here. We're here to say, we know what needs to be done. We're here to work with our community, our government, our leaders to make it happen. So I hope everyone here today is willing to fight that fight so we can do something more for our community than we are today.
Thank you so much, Tina. Really appreciate how you articulated that in such a candid way. And now we come to the last, what I would call crisis that I want to talk about today, and that is our behavioral health care system. Tina already talked about staffing shortages, so I won't go there again, even though that certainly applies to behavioral health care. I'll touch on some other aspects of our behavioral health care system that need attention. So many of you know that I approach this work as someone with lived experience of mental illness. Timely access to the right level of care saved my life twice. But those crises took place in other states. If I were to have a mental health emergency today in Rhode Island, I'm not confident that I would receive the right level of treatment in a timely manner. After decades of financial neglect, there are quite a few holes in our continuum of behavioral health care. Low Medicaid and commercial insurance reimbursement rates de-incentivize providers from participating in those networks. And that's why patients like me go on wait lists. I've been on a wait list for 5 months for a psychiatrist for medication management services. I take a medication that helps me feel fully alive instead of half dead. It's tremendously helpful to the quality of my life. And it would be good to have a mental health expert manage my medication for the long term. Not only do we not have enough providers, but the provider pool is lacking in linguistic and cultural diversity, which makes it more difficult for people of color, immigrants, refugees, and people from the LGBTQ community to find providers that they can relate to. And that's so important for the therapeutic process. Like many states across the country, Rhode Island's prisons have become the largest psychiatric institutions in our state because we've neglected to adequately fund supportive housing for people with serious, persistent mental illness and other disabilities, like intellectual developmental disabilities and physical disabilities. And by supportive housing, I'm referring to housing units in the community that are tied to social services, group homes, long-term residential treatment centers, and civil commitment facilities like those at Eleanor Slater Hospital. We have allowed our most vulnerable citizens to become homeless and incarcerated for crimes related to their disabilities. And what does that say about us? My next point is, considering that 100% of people on this planet have a thing called mental health, and considering that 1 in 5 of us, 1 in 5 will experience a mental health condition in any given year, I've always wondered why Rhode Island doesn't have a standalone department for behavioral health. We are packaged with intellectual developmental disabilities and hospitals, and both of those are very important, don't get me wrong, but the behavioral health community has different needs and challenges compared to other groups. For example, we desperately need more supportive housing for people with medication-resistant schizophrenia, as one example. Supportive housing would keep this population safe and stable. It's a human right and a civil right for people with debilitating mental illness, because when we don't provide supportive housing, they end up homeless, in a hospital, or in prison, and that's unnecessary institutionalization. On the other hand, people from the intellectual developmental disability community might feel that supportive housing is unnecessary institutionalization, and that's fine. But that's not true for people with serious persistent mental illness. It's not the right framework for that population with life-threatening mental illness. And the two populations have different needs and challenges, and we can't make broad generalizations about the two groups, no matter how well-intentioned. In a similar vein, it's wonderful that substance use disorders are finally getting the attention and resources that they deserve. But I do have concerns that we're not funding mental health services as well as substance use disorder services. Again, substance use disorder treatment services, prevention, I'm behind it 100%. It's so important. But we know that people with untreated mental illness often self-medicate with drugs and alcohol. And we also know that people who chronically use certain drugs can have damage to their brain that causes mental health conditions. So substance use disorders and mental health conditions are inextricably connected, and each one affects the other. And I wonder if we can't provide more robust funding to both. We also know that peer support specialists are evidence-based and an important part of recovery for many people with mental illness, including substance use disorders, and we must prioritize peer support services. And lastly, we could have a full continuum of behavioral health care if we only had an Olmstead plan in Rhode Island. Olmstead refers to the 1999 United States Supreme Court case, which ruled that unnecessary institutionalization of people with disabilities is a violation of the Americans with Disabilities Act. States must provide supportive housing and community services to keep people with disabilities housed and in the community as much as their disabilities permit. States that want to demonstrate their intent to comply with the Americans with Disabilities Act form plans, often called Olmstead Plans. These plans do a quantitative assessment of the supply and demand of supportive housing, affordable housing, community services, treatment facilities, and they coordinate these resources and put permanent funding streams in place to support them. Rhode Island is one of 7 states that does not have any type of a plan, and we are about 20 years behind the times in that regard. In closing, homelessness is a policy choice. Allowing our prisons to become psychiatric institutions is a policy choice. Climate change is a policy choice. Low Medicaid reimbursement rates are a policy choice. Rhode Islanders care deeply about these issues. We're affected by these issues, and we're looking to our leaders to steer the ship in a different direction. We are looking for heroes today. And let's begin the dialogue with Governor McKee. Governor McKee, I want to start with the most immediate and life-threatening crisis because people's lives are literally on the line, and that is our growing homeless population. Each year, about 4,000 Rhode Islanders become homeless. The pandemic's economic devastation caused a 17% increase in the number of people living outdoors. 90% of our homeless population are people who can't find affordable housing, but would never be homeless again if they had affordable housing. We already talked about tent encampments. People are living on the streets, winter is coming, and people will die. So given that Rhode Island received this windfall of ARPA funding, Governor McKee, can you talk about what your supplemental budget might include in the short term for addressing the immediate crisis with winter on the way, and what your plans for the long term might be to address homelessness? Thank you so much.
Yeah, Laurie. So, I mean, I think that everybody has recognized that housing is an issue, whether it's from homeless all the way up to fair market value housing. We really do need to find a way to fill those needs, and we need to create a long-term plan. That's what the 2030, Rhode Island 2030 is about. I think that it would really encourage everybody to participate in those sessions as you're doing today, specifically into a roadmap on 2030 relative to the issues that you brought up today. So short term, I think that there's, there's an effort to be made, and it has been started. And the funding that I put in, that I've asked for supplemental is 10%, is meant 10% of the funds to address some of the housing issues. I think that that's important. We mentioned the legislation that we put in last year for a sustainable revenue source. I think that for the first time, you have some money. I don't know if you have $500 million, Daria, because I mean, when you start, even on this call, when you start adding up what the asks are, it's going to exceed, it's going to be considerably more than $1.1 billion, right? So you got to be smart about the way that you appropriate dollars. I do, and I've been publicly stating that it is getting cold, and there is a need that needs to be identified short term in terms of housing. I just came back from DC on Thursday and Friday, meeting with a few governors, Democratic governors, along with the Speaker of the House. Had a private meeting with her, Speaker Pelosi, and also private meeting at the White House, and which included an hour visit with the president. So I think that they're aware that there's some, all the issues you've talked about and more. And we do have funds. I think that we can do a short-term strategy on the immediate need if we're smart. I did talk to a person by the name of Gene Sperling. Gene is involved with the management of the rental assistance program. Rhode Island has been fortunate, quite frankly, to receive the minimum, which is $200 million. And we've been asked them, because we've been slow in getting the recovery dollars out, and it doesn't appear as though they're coming out before winter. So maybe I'll be pleasantly surprised if they come out sooner. But we're trying to see whether we might be able to use some of those rental assistance dollars to address the short term piece that we're dealing with right now with people who are looking for shelter and homes, and we think that we're might have something on that, on the short term basis. So yeah, in terms of spending the recovery dollars, I would refer to the 2030 plan. That seems to be an all-encompassing strategy. No dollar items have been put in there, but that's going to be a working document. As far as the issues that you just mentioned in terms of the housing, I really do think that we need a plan. I hear numbers that are as low as 376 people living on the streets right now, and as high as what you just said is 4,000 people. So what is the number? And you hear, so I think that we need to zero in on addressing the immediate needs that we have right now, but also not lose sight of what the long-term strategy in housing might look like. But I think the first thing that I would do is really dig into just why we're doing it on the 2030. Let's have a definitive plan so that we know where these houses are going to go. I mean, 22,000 rental houses, Laurie, where are they going? What communities are going to house them? How are they going to get built? Where are they going to be retrofitting in existing structures, or are they going to be new construction? Those are all unanswered questions that need to be answered.
Thank you, Governor McKee. Now I'm taking questions from the audience. So again, if you have a question, please type it into the Q&A box. One question is, piggybacking on what we were just talking about, why is it taking so long to get Rent Relief Rhode Island funds into the community and to families that are right now at risk of losing their homes? Is that a question you can answer, Governor McKee?
Well, if it's a home ownership, those dollars have not become available yet. We're anticipating that the federal guidelines out of the Treasury will be setting those up shortly. If it has to do with rental assistance, and in terms of apartments, we have accelerated tremendously. $1 million went out in the first 90 days. We stepped in, working around housing. I think we're close to almost $60 million distributed now of the $200 million. So we are moving in a path. I just had a meeting yesterday with community action programs with Rhode Island Housing, talking about how we might be able to connect the two organizations together so that we're identifying people that maybe are falling through the cracks or are waiting for assistance. So the good news is there's money there. I think there's also good news that there's an appetite to distribute those dollars, and our office is more than willing to facilitate any pockets of, from an individual to a group that is being serviced by any particular organization, and to really pay special attention there so that we are getting those dollars out. We don't want to lose any of that $200 million. We receive far more on a per capita basis than virtually every state in the country because there was a minimum amount. So it may seem as that it might be a slow process, but as long as we're keeping pace with the numbers, we're going to hold on to that $200 million. Remember, it's also for rental assistance, but it's also for utilities, heat assistance, whether it's gas or fuel oil, as well as cable, as well as if you are paying a water bill and you're a renter. So there's many ways that those dollars can get out. And if you have, if the person asking that question has a specific people that they want us to follow up on, we'll do that. If it's more of a general comment that there's a large group of people waiting on that assistance, if they can kind of define how to make that contact, we're more than happy to do that.
Thank you, Governor McKee. The next question I have is sort of a follow-up, but it's more about our Rhode Islanders living with disabilities. They have different types of housing needs, for example, supportive housing, group homes, scattered site housing in the community, and so forth. The person is asking, how can we address the immediate and long-term housing needs of the disabled community? Any thoughts on that today, Governor McKee?
Well, I think that, again, I really do think we need to zero in on the numbers so that you can actually address it. So, a global question like that, I do certainly agree that there's a need and there should be a path towards addressing it. But until you actually get, really specific in terms of what they are. And, I had a very good friend that I was friendly with that was quadriplegic that required housing, required care to actually get in and out of the beds. Many times I put Peter in and out of his bed. So we've all experienced, and I'm certainly a great deal more with people on this call than I have, but I do understand that there's a need. It's got to be identified in a way where you can actually work off a strategy. And so I think we agree there's an issue. I think that we need to really kind of streamline that down to individuals like my friend Peter or collectively. And it is a complex issue, right? So, but we're willing to try to work collaboratively with people who want to address this. And the more information, that's why this is a good call. And I appreciate the opportunity to be listening more than talking. But I think that the housing issue is all encompassing. So it runs from the needs that just were asked the question, homelessness, and it really runs right into fair market along with middle class housing, work housing, low income housing, and so I think that that's included in that package. Short term, I would really be looking at the possibilities that we've never had, right, as a state, right, is that there is some funding that is available, as you said, that was not available and not normally available. So I would continue to advocate for those issues in the process of the upcoming session in the General Assembly. We're asking for 10% to be put out right now. It is very possible that if we don't get that out this fall, I'm very concerned that we're going to lose ground in many areas, including getting people back to work so they can earn an income, so they can pay their rent, right? And they would have less issues relative to housing stress on their lives. So we're asking for 10%. There's still 90% left. I would imagine that we're going to be putting another supplemental in because the fastest path, I think, is to use the existing $22 budget. But if you rely on the fiscal year 23 budget, that means that these dollars you're talking about, if in fact they are appropriated, will not get into the stream until this time next year. And I don't think we can wait. I certainly can't wait on the issue that winter's coming for people who need housing. And also, why would we wait on good projects and hold on to money in the bank when those dollars could be actually used in a way that can help people?
Well put, Governor McKee. I couldn't agree more. We definitely have to start taking quick action before people start freezing to death on the streets. One way, because I love how you talked about using data and really getting to the bottom of what the numbers are. And one way to do that is by establishing an Olmstead plan, which a governor might do through an executive order. But an Olmstead plan, year one, you start with a quantitative needs assessment, looking at the supply and demand of affordable housing, supportive housing for people with disabilities, community services, transportation, all kinds of resources that would keep people out of institutions like hospitals and homeless shelters and in their homes if that's where they want to be, or in the least restrictive setting possible. Would you be open to discussing the possibility of establishing an Olmstead plan in Rhode Island? This is something that's really important to Rhode Islanders, and there's a broad coalition of people advocating for an Olmstead plan, people from the intellectual developmental disability community, people with physical disabilities, our older adults, youth at risk of institutionalization, and people with serious persistent mental illness. We're all working together to get an Olmstead plan. What are your thoughts on that?
I really think it's going to be part of this discussion, and I really think that you should be, involved. And the reason that we put out a Rhode Island 2030 plan was to address, what Rhode Island would look like in 2030 and give people the opportunity to actually weigh in. We didn't create this super committee, that was closed in terms of, oh, this is what we're doing. No, I felt that everybody in the state should be part of that committee. It's a working document right now. We'd encourage you to voice that in these public sessions that we're going to have around the state. We had one canceled last night because of the weather, but we have 5 of them set up all around the state. And also, we're willing to bring those sessions and discuss those into different settings. Different communities are asking right now to kind of have the ability to weigh in. So I think that's the place to really weigh in. I also want to just talk, it might be not directly related, Lori, but there was a consent decree that was in place in 2014 to address, I'm not sure specifically the same issues you're talking about, but certainly in the issues that in the same category, right, of addressing some disability. We aggressively went, and what wasn't done for 6 years or more, 7 years or more, we aggressively went and worked out an agreement on that consent decree, was announced last week. So we're going to do everything that we can do to make life better for the people in the state of Rhode Island. And I would also, I do want to frame setting expectations on $1 billion. It's not a lot of money, right? And so, and also there's a relationship that is the one that's real and practical, that as we address some of these issues that have been like that particular consent decree, 7 years. You mentioned Zambarano Hospital, with the whole LNS Slater issue. We've been sitting on as a state sitting on our hands on those issues for years. I think that in 7 months since I've been governor, we've made significant, moves there to establish patient issues with the families along with the staffing, and we'll be proposing facility issues in this upcoming budget as we did in the last budget, but the General Assembly felt as though they needed more details. So yeah, I would participate in these meetings. I think you advocate for what is you really believe in. The more information you can bring to the table, the stronger the argument gets. And that also, but I would also say that as we do, and I've worked in budgets for years and as a mayor, I understand when there's when there's a cost, there needs to be a corresponding income that's going to offset it, right? So if we're restructuring state budgets and it requires more funds, then there's going to have to be an offset of either a reduced expense or a new income. So I would keep that in mind in all the discussions that we have, but I would encourage you to participate. The reason why I did the 2030 sessions and didn't come out and say, oh, this is our plan, because then it would have been perceived as my plan. We need a plan that gathers support from the state, because over that period of time, over the next 9 years or more, there's going to be a need for buy-in from the general public on investing right in the areas and needs that we're advocating for, and there's going to be a need for strong public support for that. So I would engage in this 2030 strategy and really advocate for your positions that you're expressing today.
Governor McKee, I understand that you're holding in-person community listening sessions around the state. Would you like to speak a little bit about that for those who are here today who might want to attend a listening session to continue the conversation with you?
Yes, so I would go to ri2030.com if you have access. As everybody has access that's listening today, and that's one of the reasons I took the call today, was to engage in a public way. So I would go to ri2030.com. On that, you can actually pull up a PDF of the 50-page report. You can go to specifically the areas you're interested in, but I would kind of make sure that you take a look at all the areas, whether they're in renewable, economic, or hospitality, or travel, or wherever they might be, or behavioral health, children and families. And then on that 2030, there's specific dates and locations that we're going to be. I don't have the schedule in front of me right now, but somebody's giving it to me. So if you want me to, right now we'll be on Thursday, October 28th. We'll be at Hope in Maine and Warren, 5 p.m. On Tuesday, November 2nd, we'll be at the Community College of Rhode Island and Warwick at 5 p.m. And right now is scheduled to be on November 4th at Innovate Newport. So we'll be in Newport at that time at 5 p.m. as well. And then Tuesday, November 9th, we'll be at United Theater in Westerly. So those are and then we had one canceled last night. It was postponed, will be rescheduled, which was at the Harry Kazarian Elementary School in Providence. So we're going to try to get in every county. And then if there's interest, we'll have more, because the more participation we get as a state, my hope is that we really arrive at a plan that can still be a working document, but it starts giving us direction in terms of how we improve the state of Rhode Island for all 39 cities and towns, and the communities that make up our communities in all 39 cities and towns.
Governor McKee, do you have 30 seconds for one last question that's popped up 10 times that I'm reading?
Yes, I can't answer it 10 times, but I can answer it once.
Inquiring minds are desperate to know if you can speak a little bit more specifically about how you might address the staffing shortages in Health and Human Services. Any ideas?
Well, we have ideas. There's long-term strategies and short-term strategies, right? I mean, the long-term strategies is to, really develop skill sets through our schools, our education, and during different strategies. Short-term, we're experiencing what every state is experiencing right now, where there's a shift, not just in healthcare and behavioral health services, but it's a broad-based issue that we're going to try to address. We did put something in there to address some of the childcare in that down payment plan that we have, which I think is, if that was successful, it might be a model that we can use, with these dollars, which is kind of incentivizing people to kind of work in the childcare area and in the immediate area that's working with our families. That's specific in our request. I think that may be a model we can use. Right now, we are doing something so that if you're specifically talking about any particular industry and what you're talking about here, we do have a program that we expected, again, pilot next week that hopefully can be a model that the state General Assembly would be willing to invest in, which has to do with job training and also identifying who is sitting on the sidelines right now, trying to figure out why they are sitting on the sidelines. We had 45,000 people come off unemployment 3-4 weeks ago. We are lowering our unemployment rate, but I think we need to be intentional about how to match up the people who are not employed with people who need employees, and then have both sides of the equation kind of understand each other about what it's going to take to do that. So I can tell you that I think on the where the vaccines, where, like I mentioned, we got 90% vaccinated. We expect that keep on that going now with the 5 to 11 students, and continue doing that work. But what you're talking about is, I think, is certainly a top priority for me relative to getting people back into the workforce, understanding that they need to get paid to do that in a way that makes sense. And I don't know of another issue that's more important to our economy than this one on a short-term basis. Long-term, I'm looking forward to really establishing strategies that help train and prepare people for job positions that we need. And again, my ultimate goal is to increase per capita income for the people who live in the state and work in the state.
Thank you so much, Governor McKee. We really appreciate hearing from you today. And thank you for listening to our concerns and for having the listening sessions. I think you had one in Providence recently. I think that one's already passed, but we have others throughout the state over the coming weeks. And for folks who want to continue this dialogue with Governor McKee, I highly encourage you to attend and you share your ideas with him, because he's open to your ideas. He's asking for your ideas. He's asking for your expertise and your input, and we appreciate that. Any closing remarks, Governor McKee?
No, just thanks for the opportunity. I think that these sessions are very productive, and we're going to do the best we can to, which I say every day, get up and do your best, right? And knowing your best is hard work. And I appreciate the hard work of the individuals that are here today advocating on behalf of people who have needs. And I'm listening, and we're trying to stretch the dollars that we have as best we can to address as many needs as we can. But again, I really encourage you to get involved in that 2030 session.
Thank you so much.
It's something that could be very helpful to the state, and we look forward to your input. So thanks, Laurie.
Thank you, Governor. Have a great day. And thank you, everyone, for joining us today. This event was recorded. It will be placed on our YouTube page later this afternoon. This was just the beginning of this conversation, and we'll continue it hopefully with Governor McKee and members of the General Assembly in 2022 when the General Assembly gets started again. Hopefully we can all come together again to share ideas and provide input. So thank you all for attending today. And I'm sorry if we didn't get to your question. We had limited time today. But like I said, we'll do this again, I hope. So have a great day. Take care of yourselves and take care of each other. And we'll see you next time. Bye-bye.
Thank you, Lori.
Bye.
Bye.